So first I would verify my order, then I would gather up all my supplies, and I would come in, introduce myself to the patient. I'm Alex, I'm your nurse. I would verify their name and date of birth, ask them about any allergies that they had. Then I would explain the procedure to them after I gave them privacy. I would just say we're suctioning your tracheostomy tube and cleaning up around it. Then I would position the area to make this easier for me. So I would raise the bed, get all my stuff laid out how I wanted it to. Then I would position them in a semi-Fowler's position with their head extended. Then I would look at the suction device, make sure I attached one end of the tubing to it. I would turn it on, make sure it's working. It's working right now. For an adult, it would be between 80 and 120 millimeters of mercury as the suction pressure. Then after that, I would get on my clean gloves after I did hand hygiene. Throughout this, I would have this face shield mask on, but for the video, since you won't be able to hear me, I'm just gonna put it in front there, and I'm gonna get the handy bag ready. Just put it right here. Then I would assess the respiratory rate, or look for any signs of hypoxia. Then I would use stethoscope and auscultate their lungs. So deep breath. Breath. Deep breath. Deep breath. Deep breath. And deep breath. Lung sounds were good. Respiratory rate was normal. Then I would assess their vitals. I would get their baseline oxygen and their oxygen saturation, and look at their heart rate. Then I would get this absorbent pad and lay it across their torso. Then I would get ready and open up all my kit stuff. So I get my trach holder out. Have that ready for later. Here. Open up my kit. Put in my cannula. That way. And I would get my sponge open for when we dry it off later. Then I would get my sterile saline and pour it into the basin. And once I pour that, I would remove my gloves, and discard them, and then do hand hygiene again. And I would get my sterile gloves ready. Step back. Cooperate with me, but that my gloves are on, throw away that. This part in the middle. Then I would declare my dominant hand sterile. Non-dominant hand is not sterile. I'm gonna adjust my field, take stuff out that I don't need real quick. Okay. So now with my sterile hand, I pick up the catheter. Okay. Gotta get the green part. And with my non-sterile hand, I'm gonna make sure the suction's back on again. And I'm going to connect the catheter to it. And I'll put the tip of the catheter into the saline and make sure the suction's working well. So, okay. Then adjust this. Then it's about ready to do the first suction pass. So I'm gonna loosen their oxygen mask. And I'm going to give them 5 to 6 breaths with the ambu bag. 1, 2, 3, 4, 5, 6. And once that's done, I'm going to quickly insert the catheter until I feel resistance. There's resistance. And only applying suction on the way out. I'm going to twist the cord, or the catheter. And then once we're done with the first pass, I'm going to quickly put the ambu bag back on and oxygenate them for 30 to 60 seconds. Or encourage them to take deep breaths. So now that that's done, remove the ambu bag and do our second pass, which will be our last pass for the video. So again, go until I feel resistance. And suction on the way out. Okay. I'll reapply the oxygen. Once we're done with that, I would turn off the suction device. I would remove the old catheter and I would throw that away. Get this out of the way too. And then, now that we're done with the suctioning, with my sterile hand, I'll pick up the new inner cannula. And with my non-sterile hand, I will pinch and take the other one out. Quickly place it with the new one. Then I will put that back and dispose of their cannula. Then with my sterile hand still, we're going to clean around their outer cannula and the skin around the stoma. So I'm just going to remove their old dressing. And I'll take the saline soaked swab. I'll do all of the outer surfaces. Keep their oxygen on in between, throw that away. Get my new swab and do the skin around the stoma. Moving outward as I'm cleaning. throw that away now. Then I would get my gauze and I would pat everything dry around the area. Okay. Throw that away. Then now that everything's dry, I'll put on their new dressing. Go from the top down. Their oxygen. Okay, now it's time to switch out their trach holder. So normally you'd have, or ideally you'd have someone come in and help you with this, but I don't have anybody with me, so I'm just gonna have them lean forward and have the brown side touching the skin. Undo one side, remove the tie, and while making sure the faceplate doesn't come out, holding down on it, I'm just going to add the new one in, undo the other side. Oxygen back on. We'll probably just put this to the side, and I'll make sure everything's adjusted right. And there's two fingers in between the skin and the holder, so that's everything replaced. After this, I would clean up my area. I would provide patient safety, lower their bed, give them their call light, ask them anything else they needed. Then I would clean up my area, do hand hygiene, throw my gloves away. I guess I would throw my gloves away and then do hand hygiene, and then I would go document that I cleaned their tracheostomy and replace their dressing.